Hello, everyone. So I've not, well, this is the first one of these. I've not been to an event like this for CCLG. So I'm a clinical psychologist. I spend about half my time in research and half my time in NHS practice. And I guess most recently, we've been working on developing a psychological intervention for children and young adults with brain tumors, which I'll tell you a little bit about in a bit. So I think I wanted to start with this, like taking this question seriously. Why focus on mental health support? I think that is a reasonable question. Yeah, as you were saying, Emma, like actually there's enough going on and some potentially like pretty crippling side effects. Why would you put something else on top of there to have to do? And if you're doing kind of a structured psychological intervention, that could be like weeks of regular appointments. Why would you add that into a mix of what is really already a difficult situation? So I want to talk a little bit about why and a bit about how in that kind of context this could work. So I guess the kind of primary reason for why is that it's what people would say is important. So this is from a kind of a review of people, adolescents and young adults survivors of childhood brain tumors, what they said were the most important needs at that point in time and directly after treatment. And actually, they didn't place physical concerns at the top, even though that is obviously essential, really important. They put social concerns as the most important. Then after physical came psychological concerns, as in it wasn't just, it's not the only thing going on, even though it takes a lot of effort, a lot of energy to put into the kind of physical side of things. There are other things going on, particularly if you're like an adolescent who is kind of establishing what you think the world is about, establishing a friendship group and maintaining that, academically doing what you need to do there. There's a lot of other things going on which can easily get lost in the mix of what's happening. And I suppose it's worth just flagging up that the kind of mental health, psychological impacts can be quite wide-reaching and can last a long time. So there's greater risk of depression long-term, increased social isolation, it can affect self-esteem, it can even affect how it goes in school, feeling more isolated and things like bullying, but also this idea of it impacting the wider family. I guess these are all understandable, and as I'm saying them out loud, I'm kind of thinking, well, duh, it's obvious that would be the case. But I think it is important because when you've got a lot on your plate to deal with treatment and the after effects of that, why would you want this in? And I think it's worth saying that it is important, but also, perhaps most importantly, that we can do something about the kind of psychological impacts. There's pretty good evidence now that it can improve on a number of areas. So it can help improve depression, anxiety, academic achievement, medication adherence, how you manage your pain, how hopeful you feel. Even no matter what your prognosis, hopefulness and optimism is a really beneficial trait that you can now train. And it improves the quality of life by adjusting how you manage the things that are going on, however that looks. So, and I suppose lastly, the James Lind Alliance did a priority setting kind of task. And this kind of psychological support package that could improve well-being, social functioning, and mental health was the top research priority. In that, actually, we don't have that nailed, and it is important. That kind of combination put this as kind of a key priority. So, how would we do this in a way that doesn't feel tokenistic, doesn't feel like it's kind of overwhelm someone who's got a lot going on, a family that's got a lot going on already? How would you approach this? Well, this is one of the aspects that the research team that I've been working with have been looking at in an acceptability and feasibility trial of an evidence-based psychological therapy called acceptance and commitment therapy for young people who've had brain tumors, who've finished treatment, or ACT as it's called. So ACT is a bit like the Serenity Prayer. So it's moving towards accepting the things that cannot be changed. So there will be elements of this where it's important, but actually me putting my energy in that, my efforts in that direction is not going to make any difference there. So I could really hate the way that they put double yellow lines in places where I didn't want them to. But actually, I'm really unlikely to be able to make a difference in that area, whereas there might be somewhere that's really important to me where I could make a difference. But actually, sometimes to change the things that I can be difficult, and I might need courage to do that and be aware enough to know where I can make a difference and where I can't. So there's kind of 3 skills in ACT. One is kind of letting go of the struggle with things that I can't change, identifying what really matters to me, what's the kind of direction of life I want to be going in, and what are the actions that move me in that direction, and then kind of having enough awareness to be able to tell the difference between those 2 things. So I'm going to borrow Ellie to kind of help me illustrate the point of what we're trying to do in ACT, in acceptance and commitment therapy. So if we start off by taking something that is likely to come with cancer treatment or the after effects of it. So I'm using pain as an example, but this could be anything really. It could be fatigue, it could be nausea, it could be just fear, sadness, whatever it may be. This is something that has come with the situation I am forced into. I cannot put this burden down. This is something I like. There's no point in me trying to get rid of this, pushing this away. It's part of the gig. But if I'm a normal human, functioning normally, doing what a human should do, it's really likely that I'm going to want to avoid this pain. We're hardwired to do that, to try and get away from difficult things. But actually, with avoidance, I might mean that I stop doing things that really matter to me because I'm trying to get away from this difficulty. I might be kind of avoidant of things that make me anxious or fearful or sad, or maybe make this pain worse. So now I've got both the pain and this kind of avoidance. I've got more to it, but this is just being human. You would do this kind of thing. But there's a weird thing about avoidance that we now know, is that the more I try and avoid things, actually, the more preoccupied I can become with them. So for example, if I said to you, don't think about a pink elephant. You can think about whatever you want, just don't think about it. That's the only thing you don't need to think about is a pink elephant. I don't know if your brain is doing what my brain is doing, but all I'm thinking about is the pink elephant. So in order to avoid things, I have to be saying in my head, don't think about the pain, don't think about the pain, don't think about the pain, and getting more preoccupied with it, which can lead to this thing called rumination. That is where I am thinking about something that no amount of thinking is going to solve. I could think about it all day long, and it's not going to